Assalamu alaikum and welcome to Doctor in the House. I am Dr. Topic.Men and I will want to introduce myself a little bit as this is the first time I am currently hosting this program. I graduated from the University of the West Indies in 2019 with an MBBS degree. Subsequent to this, I went on to complete my internship at San Fernando General Hospital and then was employed by the Southwest Regional Health Authority as a house officer in emergency medicine for approximately 2 years, after which I rotated through anesthetics and ICU, then general surgery, after which I did a rotation in internal medicine. Then I went to my true calling, which was family medicine, and I'm currently practicing in primary care at the Southwest Regional Health Authority. I hold a diploma in pediatrics from the Royal College of Physicians in Ireland, and then I have completed a postgraduate diploma in family medicine from the University of the West Indies, and I am currently pursuing a Doctor of Medicine in family medicine. Today I am joined by my dear friend and colleague, Dr. Nadeem Kothiwala. Nadeem, how are you doing today?
Wa alaikum salam wa rahmatullahi wa barakatuhu, Tawfiq, and thank you for having me here today. Alhamdulillah, I'm good. I'm glad to be here. Now, like you, I'm also a family medicine practitioner and also studied locally here at the University of the West Indies, where I did my MBBS as well as my postgraduate studies in family medicine. Apart from being a family medicine practitioner, I do have a particular interest in palliative care, and for which I studied in the Trivandrum Institute of Palliative Sciences in India, and currently practice privately with Live Health, a company that offers private palliative care in Trinidad and Tobago. So thanks for having me here today, Tawfiq.
Okay, Nadeem, nice introduction. So today we want to discuss a very important topic, and me and Dr. Kothiwala, being men, it is a topic that should be close to our hearts. As this topic is men's health, we want to focus on the man, the head of the home, the person, as some people believe, to be in charge of the household. So, Nadeem, do you think this is an important topic to discuss?
No, definitely, Tawfiq, and I'm sure we see it all the time in practice where men often put their health last. Interestingly, statistics from the World Health Organization for Trinidad and Tobago shows that the life expectancy for a male is approximately 73 years old, as opposed to 80 years old for a female. So it's quite a significant difference between male and female life expectancy. And this is also reflected by international data as well too. Apart from the difference in life expectancies, males also have a higher risk of preventable medical conditions as well as a higher risk of some cancers. So it's very important that we have discussions like this today where we could try to inform and educate on the importance of men's health with the aim of really encouraging men to have their regular checkups done.
Very important. Well said, Nadeem. So we want to take care of our fathers, our sons, our brothers, and we want to change their attitude towards health. We want these people to pay special attention to preventing any medical conditions that they can by properly screening. And we want to have these men have early screening and a balance in their life to have a happy, successful life. So Nadeem, we notice that men are less likely to visit the doctor. The CDC actually says that men are 33% less likely to go to the doctor than women. What do you think about this?
So yeah, that's quite right. And as I said earlier, it's something that we see in practice. I myself was asking myself that question, why am I seeing less men in practice? So in looking into it, there was an international study published that surveyed approximately 1,000 men. And some of the excuses that men gave for not visiting a doctor regularly, the more common excuses were that they were not feeling ill, or they didn't have the time to go and visit a doctor. But what was interesting, another popular reason that a lot of men gave was that they were afraid to find out what the doctor might say. So what that tells us is that while some men don't see the importance of regular checkups, there's also a significant portion of men who just are a bit too afraid to be able to, or don't have the support to be able to go to the doctor even though they want to. So this further highlights the importance of having these conversations where we could break the taboo and the stigma associated with men's illnesses in order to be able to encourage our men to visit their doctors.
Very well said, Nadeem. And we notice because of this delay in presenting to the doctor, oftentimes when patients present, they present in quite an advanced state of illness, right? And this could probably account for the shortened life expectancy in men versus women, as many men may present later on in cardiovascular disease. They may have diabetes, high blood pressure, high cholesterol, and only when they become symptomatic, they present to the doctor, which is quite unfortunate, right? We want men to present earlier because in the Caribbean, the leading causes of death among men are things like stroke or heart attacks, things like cardiovascular disease, high cholesterol, and most of these things are preventable. Preventable being the key term there, Nadeem, right? So you could just tell us a little more about the preventable aspect of this?
Yes, so Taufik, you're very right. That key word is preventable. And when we think about medical conditions and medical illnesses, we always like to think about the risk factors for these conditions. So we have risk factors which are non-modifiable, meaning they can't be changed. Things like our genetics, our ethnicity. Some of these things put us at risk of medical conditions, but we have no control over these things. But a huge portion of these medical issues have modifiable risk factors, or what we call lifestyle risk factors, which could be changed. And some of these common risk factors are things like diet, lifestyle like exercise, as well as things like smoking and use of alcoholic substances. All of these are modifiable risk factors that, if adjusted and changed, can have a significant improvement in someone's health.
Very well said, Nadeem. And too often we see the man's wife, the mother, the sister, the daughter dragging them to the doctor. It's about time men own up and take ownership of their health and really prevent these diseases from capturing their life and sometimes even ruining their lives, right? So men should take ownership of their health, Nadeem.
I fully agree, Taufik. I mean, it's like servicing a vehicle. It's much easier to take your vehicle for its annual checkup, change its oil and filter on a regular basis, rather than waiting for the engine to go or for it to totally shut down. And that's the same way we need to start thinking about our health. The annual checkups, there are a lot of things that could be caught early and addressed in order to prevent the more disastrous outcomes later on.
Well said, Nadeem. You see it in a way that men will understand, because some men understand their car better than their own health. It's unfortunate, but it's true, right? So just like this, the men should take preventative maintenance on their own health. So throughout this segment, we want to talk about different aspects of men's health. We want to talk about the lifestyle changes for men. We want to talk about men's mental health, something dear to my heart. We want to talk about men's sexual health, an often taboo topic that a lot of men are ashamed or afraid to talk about. And finally, but probably most importantly, we want to talk about prevention and screening. So Nadeem, we will talk about these topics over the coming minutes, and now we want to break for a short commercial break.
A meeting of friends, a familiar place, the first sip of something special, a moment of connection, a journey into nature, the sound of flowing water, the warmth of the sun, laughter, friendship, and a taste as bright Lessons passed down, memories created. The cool touch of the river, the crackle of a fresh drink. Moments like these are what stay with us forever. A sip of serenity, refreshing and pure. The gentle rustle of leaves. A push beyond limits, strength in motion. Every step, every heartbeat, every challenge met with unstoppable power inside. The fuel to go further, to push harder, to be more. The grind, the focus. And at the end of the day, we come together. A table full of flavors, a room filled with laughter, a night of stories and memories. Different tastes, different moments, but one feeling. Because the best things in life aren't just tasted, they're shared. Taste Sultan drinks now. You know what you drink.
Assalamu alaikum. In this, our 20th anniversary of existence, we here at IBN want you to be a part of our family. Call us at 663-4762 or 795-5900. Those numbers again, 795-5900 or 663-4762, and be a part of our advertising campaign. Glorious and available rates to you and your company. So remember, call us here at IBN 663-4762 or 795-5900 and be a part of the IBN family.
At Extra Foods, we care for you. That's why we always have the widest variety, the best prices, spacious aisles of total convenience, plus clean, safe surroundings. Let us care for you. Extra Foods, always extra for less.
Welcome back to Doctor in the House. I am Taufik Hussein. So today we're talking about men's health. And as a doctor, patients often come to me and they say, Doc, you know, what tablet you have for this? What medication you have for this? They always look for a magical pill, something to solve their problems. But oftentimes we neglect the important medication, and this medication is a change in lifestyle. The patients need to be aware of their lifestyle and how they are living, what they're eating, how are they exercising. And this is not a pill, but this is a very important medication. So Nadeem, tell us a bit more about lifestyle.
So earlier I mentioned a bit about lifestyle risk factors or modifiable risk factors that can be changed, and once changed, it can significantly improve health. Now, the foundation of good health is really the small, consistent habits, such as what we eat, how much we move, how we manage stress, and even how well we sleep. The problem is that many of us in Trinidad have fallen into some very unhealthy patterns. We tend to consume very high sugar drinks, plenty of fried foods, and a lot of late night eating, coupled with lack of regular movement and exercise. So this is really a recipe for poor health outcomes.
Well said, Nadeem. Right? In Trinidad, how much things we really like? We like roti, we like doubles, you know, KFC, all these fast food chains thriving in Trinidad, right? And we don't go back to the basics. We go back to what our grandfather and our great-grandfather was to eat. Things that are more healthy, vegetables, pumpkin, bodi, baigan. These kinds of things are very important to have a balanced diet. So a balanced diet is very important. And one important thing to gain a balanced diet, especially in Trinidad, we consume a lot of sugary beverages. The soft drink, the juices. Some of the juices have even more sugar than the soft drink. So Nadeem, I would ask you to tell us very briefly about how we can exercise. So we talk about the diet, let's talk a bit about exercise. You need a gym membership to do this thing, boy?
Well, I'm glad, Taufik, that you brought up exercise, because that's a key part of keeping up a healthy lifestyle. And no, you don't need a gym membership. You'd be surprised at how simple things like just keeping active, taking regular steps, and meeting a certain amount could have significant impacts on improving your health. So we like to recommend something called the FIT principle. So we think about F for fit as in the frequency, aiming to exercise at least 5 days for the week. Then the I in the fit is the intensity at which we want to exercise. So the aim that we're aiming for is just to exercise at a rate that makes you just slightly breathless. And then the first T stands for the timing. And we're just aiming for this amount of exercise at least 30 minutes a day. With the last T, meaning the type of exercise. What type of exercise are we aiming to do? And really, it could be anything that somebody enjoys. Whether it's walking, cycling, playing cricket or football with your children, with your neighbors. These are the things that we want to focus on because we want to start thinking of exercise as something more enjoyable rather than just a task. And earlier I mentioned about just simple steps and just keeping active. So there are studies that are published that have shown that 10,000 steps or even just simply 7,000 steps of regular movement has a significant impact in decreasing the risk of cardiovascular diseases. So it could significantly decrease the risks of things like heart attacks and strokes just by keeping regularly active. So what that means is that simple walks. If it is that instead of taking the elevator, you decide to take the steps. If it is that instead of looking for the closest park to the outlet, you just park 2 or 3 rows behind, so that it encourages you to walk and just stay more active. Those things have a significant impact. You see, a lot of people now are living what we call sedentary lifestyles, where they're either in an office position and they're spending just a lot of time just staying still. And that is one of the things that we are seeing is impacting our health overall, even though we don't think about it as doing so.
Well said, Nadeem. As you say, it doesn't have to be complicated. It doesn't have to be complicated as having a gym membership and you had to rush to go in the gym and spend all this time. Simple things. Taking the stairs instead of taking the elevator, right? After work, taking a stroll around the park. As they say, at a brisk pace. They say exercising should be done at a medium to high intensity. And how do we know is medium to high intensity, Nadeem? Is when you're doing exercise, you cannot sing a song because you're a bit so breathless that you cannot sing a song. So you're going down the road, you can't sing the ABCs, so you know that you're exercising at a good pace. So these things are very important to help us with our mood. You'll be so surprised to know how much exercise could improve your mood. It doesn't only improve your mood, it improves your blood sugar, it improves your blood pressure levels, right? And very importantly, Nadeem, it improves your sleep, right? Because when your body exerts itself, it needs the rest. So a lot of people complain about being fatigued, but they cannot sleep, right? But exercise, although you might think it would make you more fatigued, it helps with your sleep. Right, Nadeem? So tell us a bit more about improving our sleep.
Well, I like that you touched on sleep because that is an area that both men and women tend to neglect. Especially in today's society where we've developed a sort of hustle culture where people tend to feel almost proud that, I wait until 12 o'clock finishing this assignment or finishing this project. I wait till 1 o'clock, I only get I go in on 3 and 4 hours of sleep. And they speak of it in almost a proud manner. But the lack of hours in these sleeps do have a significant impact on overall health. The long hours tend to lead to fatigue, poor concentration, and can even result in hormonal changes that affects both metabolism and mood in someone. So the important thing is that we want to aim for at least 8 hours of sleep per night in order to be able to function well during the course of the day. And there's one particular aspect of sleep that we often ignore, and that is snoring. It is something that we often take for granted, but could be the indicative sign of a much more serious condition. So, snoring could be associated with something called obstructive sleep apnea, which is a serious medical issue that has been linked to a significant increase in the risk of cardiovascular diseases. So for men who are known to snore, or for women whose partners are known to snore, that is something not to take lightly or to ignore. It is something that definitely requires a visit to the doctor in order to be able to fully investigate as to the cause for the snoring, and then to see how best we can address that in order to be able to improve the overall health.
Very important, Nadeem. So the goal here isn't to aim for perfection. The goal is to make small changes, but changes that are very important. Changes that, as you say, can change your life, right? Changes like exercising a little more. Changes like cutting down on the sugary beverages, right? And the important thing is to know your numbers. What are these numbers we need to know, Dr. Kothiwala? Tell us a bit about these numbers.
So when we talk about knowing your numbers, we're talking about your vital signs and key body measurements. So things like your blood pressure, your heart rate, your sugar levels, your cholesterol levels, your body weight, your height, and your waist circumference. Now, as you become an adult male, your height is very unlikely to change unless you start to get much older, but those other readings are all subject to change. And those are the things that we would want you to monitor and your doctor to monitor when you go for visits, as these are key indicative signs of your overall health. Now, the standard readings for what is acceptable may change with age, but it's just very important to be able to, as Taufik said, know your numbers and keep a record of it as you go for your doctor's visits.
Right, Nadeem. So knowing your numbers, thanks for that very important message on why you should know your numbers. Now, about 70 to 80% of lifestyle diseases in Trinidad is preventable. And it's preventable by one, knowing these numbers. So as I always tell my patients, just as how back in the day the West Indies had the deadly quartet of fast bowlers, it have a deadly quartet that we face in Trinidad that could account for about 70 to 80% of the deaths in people in Trinidad. And that quartet is high blood pressure, high blood sugar, high cholesterol, and smoking. So these are all preventable and all helped by these lifestyle changes. So this is why it is important to know your numbers. So in our next segment, we want to talk about a very important topic, a topic that men do not like to talk about. They do not like to talk about their emotional and mental health. This is very important, as men's emotional and, more importantly, their mental health is often neglected in society, and we are facing an epidemic because of this. So Nadeem, we will discuss about men's health now. So we talk a lot about men's physical health, but as the mental health is something that is often neglected. And plenty times in my practice, I see patients come in and they say, "Doc, I kind of chest pain." Or they say something like, again, gas. Or have this headache that's not going away. And they come with their wife, because as mentioned before, is the woman that dragged the men to the doctor. But the moment the wife steps out, or the female relative accompanying them, or whoever accompanies them step out, you get the real story behind it. They say, "Doc, I'm so worried. I have this financial problem. I have this social problem. I have this problem at work." So men face a lot of difficulty in dealing with these mental health issues, probably because of lack of communication. Now, I mentioned before that we are facing an epidemic. And what is this epidemic? This epidemic is totally linked to men's health. This epidemic is an epidemic of suicide among men in Trinidad. A few weeks ago, I read an article in the Express. The article was entitled Hidden Crisis of Men Suicide. This article spoke about a week where 5 men committed suicide in 1 week for different causes. One of them had a health problem, the other had financial problems, some love problems. But 5 men killed themselves in 1 week. This is something that we need to open our eyes to. And the statistics show a very tragic story in Trinidad. With between the years of 2016 to 2023, about 653 men committing suicide. And among this, men who are 60 plus, so we see the elderly men maybe facing more problems in the latter part of their life, with this being the highest age group with 112 men in this age group. And then the next highest is midlife, which is about 35 to 39 years, accounting for about 80 deaths. So these are not just numbers. These are people, father, their brother, their sons. These are lives. These are male lives being lost to this epidemic. So Nadeem, let's get your input into this. What do you think about this epidemic affecting Trinidad?
No, those are frightening numbers when you think about it. I mean, based on those statistics, more than 80%, almost 90% of the cases of suicide locally are men. And when you, exactly as you said just now, when you think that this could be your brother, your father, your uncle that are facing these issues, it really drives home how serious this issue is and why it's something that can't or should not be taken lightly. And something that we really want to address. And conversations like this today is really to help men realize that it's important to have these conversations. If there's anything that is stressing you, bothering you, if it is that is affecting you emotionally, don't hesitate to speak to someone about it. Speak to a relative or even speak to a doctor. As doctors, we are sworn to keep a confidentiality between patient and doctor, so that is a safe space to be able to have these conversations. And the scary part about men undergoing or anybody undergoing any sort of emotional stress is that people deal with it differently. So on one hand, there's the disastrous outcomes if someone takes their life. But sometimes these emotional stresses tend to manifest in risk-taking behaviors or even substance abuse behaviors, all of which are unhealthy not just for you as a person, but also for your family and loved ones. It affects your employment, it affects your job space, it affects your family, and it affects the community at large. And the unfortunate thing is that there's a big stigma associated with mental health and seeking help for it. And in our society in particular, a lot of people tend to see this as a weakness. And because of that, many men feel afraid. They feel that they cannot speak openly about it. But we are here today to be able to remind you all that it is important to have these conversations. And a doctor's office is a safe space to be able to have these difficult conversations where you know that it would be kept confidential.
Right, Nadeem. So those points are very important. And as we say before, is somebody mother, is somebody father, their brother, their son. These are not just statistics, these are individuals. And the thing about men is that they are good disguisers of these mental health problems. So sometimes we have to look out for these signs. We have to look out for them being more withdrawn. We have to think about why this individual who never used any kind of illegal substance in their life, all of a sudden they start to use something like an illegal substance. If they're drinking alcohol, they might increase their alcohol intake. And very rarely we would see a man saying something like, Doc, I'm feeling depressed. I am feeling good. I feel like something wrong with my mental health. You might quicker see a woman saying something like this. But these are signs that are disguised sometimes. So Nadeem, tell us a bit more about these signs and what we can look out for.
So exactly as you spoke just now, there are signs that if there's somebody's experiencing or you witness somebody that that is having a persistently low mood, or they seem irritable or expressing feelings of hopelessness, or if they've found that they've lost interest, there's a term that we use called anhedonia, where somebody loses interest in things that they previously used to enjoy. So you're always seeing somebody, they always enjoy watching a cricket match, watching football or whatnot, and all of a sudden they don't seem to have any interest in it at all. If there are any changes in appetite or energy levels, whether it is an increased or decreased appetite, if you find that they're more withdrawn from society, withdrawn from their job, their family, their friends, or increased use of substances, whether it is like alcohol or smoking or any illicit drugs, or if you find them expressing things like they are burdened or they're speaking about wanting to take their own life, those are definite signs to bring to someone's attention. Unfortunately, here in Trinidad, there is a suicide hotline, which is 800 COPE, COPE, which is a hotline that can be accessed 24 hours to be able to help men or women, anybody, in times like these where they may be expressing thoughts like this.
Very important points, Nadeem, and this is where we have to act immediately if we notice these symptoms. So what we have to do if we notice this with our relative, the first thing we have to do is ask directly. Say, uncle, I see like you're drinking a little more alcohol, what's going on here? Ask them, do you want to hurt yourself? Do you feel to harm yourself? And you might be interested to know a lot of them would admit it because they know they need help. And when they admit, they might talk. So the second point is to listen to what they have to say. Listen to what these individuals have to tell you, because sometimes they might give you a clue about it, but you're really bothering with them. They might say, me feeling good these days and I'm thinking about so and so. And that is your clue to listen to what they have to say. Say, well, tell me a little bit more about what's going on with you now. Right? So the second thing is to listen. And the third thing is after you listen to them, you refer them to the appropriate person. Refer them to a medical professional, whether it's their primary care doctor, which is the GP, whether you think they have to go to a psychiatrist. If you think they have such thoughts that they might warrant even going to the hospital, right? And then you make a safety plan with them, right? You plan for the future, you plan for safety, and this is where the healthcare provider would be involved in making that plan with the relatives as well as the individual afflicted by this. Now, part of that plan, Nadeem, is to build resilience. So how are we going to build this resilience, right? Now, we talked about exercise before, so you might think, well, we talked about that already, how it related to this topic. But as we mentioned before, exercise does increase and promote a better mood in people. So exercising does boost your mood. Then again, things we mentioned before, you want to eat healthy, you want to have a healthy diet, you want to have a healthy sleep pattern. As Nadeem mentioned, the hours of sleep you're supposed to get as an individual. You want to have good social support. You want to rely on your family, rely on your friends for that support that you need. And then you want to have good spiritual support as well. Go to the mosque, talk to the imam. You might be surprised to know how much the old men in the mosque might be able to help you. Sometimes you're going through a problem and you sit down in the back of the mosque and the old man say, son, now you're looking so. And you tell them, uncle, well, so. And they have the experience to tell you what to do to get out of your problems, because they may have faced the same problems in their past, right? And the other thing is stress relieving methods, right? So there are different methods, right? There's a method called mindfulness, is related to meditation, and there are methods like relaxation methods, breathing techniques, and an important one is journaling. You could write down your thoughts, and this could help your thoughts to be expressed, right? Or even informal counseling sessions where you talk to a relative or a friend, or as I said, the old man in the back of the bus, about the problems facing. Sometimes just talking about your problems gets the problem out of you, right? So we have to look for this, and men should acknowledge that having a mental health problem is as any other problem. It is not a sign of weakness. So with this information, I hope all the men that we appeal to and who we talk to during this segment, they take it on board. And if you are having something that is affecting you, talk to someone about it. Don't just keep it to yourself. Talk to someone about it. So men's health, very important, and specifically men's mental health, a very neglected part of overall men's health. And please, please, if you have a problem, tell someone. So with that, we will take our next commercial break, and we will come back very shortly.
A meeting of friends, a familiar place, the first sip of something special, a moment of connection, a journey into nature, the sound of flowing water, the warmth of the sun, laughter, friendship, and a taste as bright as the moment. A bond between father and son, lessons passed down, memories created. The cool touch of the river, the crackle of a fresh drink. Moments like these are what stay with us forever. A sip of serenity, refreshing and pure, the gentle rustle of leaves. A push beyond limits, strength in motion, every step, every heartbeat, every challenge met with unstoppable power inside. The fuel to go further, to push harder, to be more. The grind, the focus, and at the end of the day, we come together. A table full of flavors, a room filled with laughter, a night of stories and memories. Different tastes, different moments, but one feeling. Because the best things in life aren't just tasted, they're shared. Taste Sultan drinks now. You know what you drink.
तस्वीर कमाल मुहब्बा तनवीर जमाल खुदाई या मोहम्मद नूर मुजस्सम तेरा वस्फ बयां हो किसे तेरा वस्फ बयां हो किसे तेरी कौन करेगा बढ़ाई सल्लल्लाह तेरी कौन
Assalamu alaikum. In this, our 20th anniversary of existence, we here at IBN want you to be a part of our family. Call us at 663-4762 or 795-5900. Those numbers again, 795-5900 or 663-4762, and be a part of our advertising campaign. Glorious and available rates to you and your company. So remember, call us say at IBN 663-4762 or 795-5900 and be a part of the IBN family.
After 12 years, your award-winning sports program Sports Reel is back on IBN Channel 8. Join me, your host Riza Abbasali, on Sundays at 5 p.m. live. On Sports Reel, we feature the legends of sport, Kishon Walcott, Shiv Chandapal, Derek Murray, and many more outstanding sporting personalities. We revisit the magical moments in West Indian cricket history. We chat with our aspiring youth athletes on heroes of the school system. And you have a chance to win a cash prize with our sports trivia. Sports Reel, where sports and education form a great partnership.
Assalamu alaikum and welcome back to Doctor in the House. So let's continue our conversation on men's health. Now this next segment is a very important segment, but for most men is a very taboo segment. So most times, I sit in the health center, a patient would come in, they might be diabetic or hypertensive, and when you finish talk to them, you write the prescription, you write, if they need blood tests, you write it and you give it to the patient. You see they sit and they pause and they watch you. And generally, most of them might say something like, Doc, we know I'm glad is a man or a male doctor seeing today, right? And you can see that they're building the courage to ask you a question. And invariably, this question is going to be about their sexual health, right? Because men are shy, they're embarrassed to ask these kinds of questions. But it's a very important aspect of men's health. So, Dr. Kotliwala, let's get a little bit about overall men's sexual health. I hear some doctors saying your sexual health is actually a window into your overall health. What do you think about this?
Well, that's very correct. You see, sexual health is not just about intimacy. As you said, exactly that way. It's a window into a man's overall health. When we talk about some of the common sexual health issues that males face, the most common ones are things like erectile dysfunction and premature ejaculation. Those are some of the most common issues that men come to doctors with. And things in particular like erectile dysfunction is often a significant sign of cardiovascular disease. So the same way that cardiovascular disease can affect the blood vessels going to your heart and your brain, it could also affect the blood vessels and by extension the blood flow to the penis. And for that reason, when you see sometimes a male is experiencing erectile dysfunction, it does warrant a full workup and investigations and screening for all cardiovascular diseases. So for that reason, we say don't take these things lightly. There could be multiple components that might be responsible for it. In the last segment, we spoke about mental health and emotional health, and that is also a big triggering factor. But we can't ignore the significant association with some sexual health issues and cardiovascular diseases. And that's why we encourage talking to your doctor about it so that you could be thoroughly investigated and some of these things could be picked up as early as possible and treated.
You're so correct, Nadim, because a lot of men, they come and they say, but doc, is a problem with my down there. What are you telling me about checking blood pressure and blood sugar and cholesterol? And they fail to realize that there is a great correlation between erectile dysfunction and heart disease and high blood pressure and diabetes. And these all are related, as you say, through a common pathology with it affecting the blood vessels. Now, another common thing that men usually, we could say, blame as they get older is a drop in the testosterone levels. But drop in testosterone level is normal. As any man age, their testosterone levels drop. But this is normal because as you get older, the body requires less and less testosterone. A lot of men, they blame this for their obesity. They blame this for the lack of energy, the lack of physical motion and movement. They blame it for their sleep. They blame it for their stress. But this isn't the causative factor. Men have to look past this. And instead of looking for a supplement or looking to supplement the testosterone, they need to improve their amount of physical activity that they are doing. They need to exercise. They need to diet. They need to develop better sleeping patterns instead of rushing to get a supplement, Dr. Kotliwala. So there's a lot of misinformation about these supplements, right? So you could tell us a little bit about some of the misinformation about this?
Well, a lot of the misinformation is exactly as you said over there, where there's a lot of social media and promotions promoting these testosterone shots and boosters. with the hope and marketing it like it will improve a man's sexual health. But it's exactly as you said. These things are not going to work in all these conditions. And the first step is really to be able to focus on things like the lifestyle changes, the exercise, the eating habits, the sleeping habits, to be able to improve overall sexual health.
Well said. So these marketing tactics might be aimed at the older man, but as we say, as you get older, the testosterone does drop. Now another problem that men, they don't want to talk about it, they don't want to acknowledge it, is a problem of fertility. Now in society, over time, there's a lot of incidents of infertility, and most times the woman is blamed, but plenty cases are actually caused by the men. And again, we go back to the lifestyle, where men are afflicted by smoking, alcohol use, obesity, and all of these things contribute towards infertility. Even things like wearing excessively tight pants and having your laptop on your lap could cause a decrease in the quality of the sperm, right? So men, they don't want to believe that they are the problem. They want to always blame somebody else. But at some point, we have to acknowledge that we can be the problem. We can be the problem for the infertility. And this is where we need to start a move. We need to exercise. We need to drop the weight. We need to stop smoking. We need to cut out the alcohol use, right? So when it comes to these things, it's very important to have the lifestyle changes and obviously get investigated otherwise for any other causes. But now I just ask my colleague again, back into the conversation, Dr. Kotliwala, tell us a bit about safe sexual practices. Is this something important, or you could go ahead and do whatever you feel to do?
No, of course, safe sexual practices is very important. It's an important aspect of overall sexual health. And it is a problem, not just in the Trinidad, but in the Caribbean and even internationally as well too. Yes, we've made significant progress in reducing the rates of HIV prevention as well as transmission of HIV as well as other sexually transmitted infections. But it's still important that we don't take these things for granted. It's important to emphasize the importance of screening regularly. And screening for sexually transmitted infections, it's simple, it's quick, and it's confidential. A lot of people tend to have these the stigma and doubts because they may be ashamed of, what the results may show. But the truth is, a lot of these medical issues and these sexually transmitted infections are very easily treatable. Especially HIV, it's not this nightmare that it was 1 or 2 decades ago. If treated effectively, persons can continue to live a very normal life in society. But the only way we can get on top of treatment is by knowing what your HIV status is. So that's why we emphasize the importance of screening regularly and having that conversation with your doctor.
Right. So just to recap a bit about the segment, where men feel an embarrassment. They may feel shy to talk about these things. If they have erectile dysfunction, they have an abnormal penile discharge, it might be embarrassing, but to the men out there, there's always an avenue to talk to your doctor, to inform them about these problems that they may have. All right? So that something can be done and that the corrective action can happen and that we can screen you for certain diseases. Now that takes us into our another segment. So our final segment today, we will deal with probably what I consider the most important aspect of men's health, and something that me and Dr. Kotliwala, both as primary care physicians and family medicine doctors, that we love to do, and what that is? Screening. So our next segment will cover the screening and the simple checkup for the men. So Dr. Kotliwala, let's talk a little bit about screening. Now I know we're running short on time, so let's just go through it briefly. So a patient come to me and they said, "Doc, but nothing happened to me. Why I had to do tests?" How you will respond to this patient, Nadim?
So I'm glad that you brought that up, because screening is particularly dear to me, especially working in a palliative setting. Quite often I see patients coming in and being diagnosed at late stages of cancers. The unfortunate thing is that in Trinidad we have a very high death rate associated with prostate cancer and colon cancer. And the most unfortunate thing about these particular cancers is that they are actually quite treatable if detected early. And that is what really emphasizes the importance of screening. Screening means that you don't have to be symptomatic. You don't have to display any symptoms to go for screening. Screening is about early detection to allow us to be able to intervene and treat accordingly. And the beautiful thing about screening, for it to be an appropriate screening test, it should be relatively available and relatively cheap as well too, to be considered a good screening test. So sometimes it's simple things like a blood test that could give us an early indication of if it is that you might be at risk or might have a cancer. So screening really alerts the red flags for us to be able to investigate further. So when we think about screening, most commonly we're thinking about some sort of blood test, or in some cases maybe a colonoscopy. But what the important thing the point I want to drive home is to get yourself into the doctor's office to be able to have that annual checkup, for the doctor to be able to decide on what are the appropriate screening tests that need to be done. And it's even more important if you have any first degree relative with any history of any cancer or any other medical condition. Now, I don't want to just emphasize cancers, but even things like diabetes and high blood pressure, often termed as the silent killers. We have a high portion of our population that are diabetic and hypertensive. So if we could pick up on these before you display any symptoms, it can allow us to treat and intervene accordingly. So it's really to be able to re-emphasize the point of getting into that doctor's visit, having that annual checkup done, giving the doctor your full medical history and family history, because the family history helps to determine what are the appropriate screening tests that need to be done for you, and then to be able to go from there with the aim of really being able to treat you and improve your overall health.
Couldn't say it better myself, Nadim. So today we discuss a big topic and a lot of things about this topic. But in summary, what I have to say is that your health is a trust from God. In Islam we say it's a manna, it's a trust from Allah. And we have to, as men, take responsibility for our health. And knowing all of this that we mentioned throughout these segments, we should really start today and take responsibility for our health as men. So all this being said, I would like to thank everyone for viewing our program today with me, and on behalf of my good friend Dr. Kotliwala, we would like to thank you all for viewing, and tune in next time where we will have just as important, just as impactful information on your program, Doctor in the House. Thank you. Assalamu alaikum.